Recovering after open heart surgery is not just about resting in bed and waiting for time to pass. It is about following a smart, structured, and medically guided plan that allows your heart, lungs, muscles, and mind to rebuild strength safely and steadily. And today I want to walk you through exactly how to recover faster, smoother, and with fewer complications. Just as I would explain to my own family members if they had undergone bypass surgery or valve replacement, because the first truth every patient must understand is that healing happens in stages, and every small action you take each day either helps or delays that healing process. So from the very first morning after surgery, your focus should be gentle movement, proper breathing, good nutrition, medication discipline, and emotional calmness rather than fear or complete inactivity, because lying still for too long weakens muscles, reduces lung capacity, slows circulation, and increases risks like pneumonia or blood clots. Which is why we start with something as simple as deep breathing exercises, slow inhalations through the nose expanding the lungs fully and controlled exhalations through the mouth, repeated every hour while awake, because these breaths re-expand the lungs, improve oxygen delivery, and reduce post-surgery complications. Then comes the next step, which is sitting up and standing early with assistance, because gravity itself helps circulation and prevents stiffness. And although many patients are scared to move thinking they might damage their stitches, remember your sternum is wired securely, and gentle movements are not only safe but necessary, followed by short slow walks in the corridor, first 2 minutes, then 5, then 10, gradually increasing every day, because walking is the single most powerful recovery medicine for heart patients, as it improves blood flow, strengthens the heart muscle, enhances lung function, prevents clots, controls sugar levels, and boosts confidence at the same time. And while you walk, you must practice pacing yourself, meaning slow steady steps, relaxed shoulders, and controlled breathing instead of rushing, because recovery is not a race but a rhythm. And along with movement, you must pay equal attention to your incision care by keeping the wound clean and dry, avoiding tight clothing, watching for redness or discharge, and never scratching even if itching occurs, because itching is actually a sign of healing nerves. And nutrition becomes your next pillar of faster recovery, since your body needs protein to repair tissues, fiber to prevent constipation caused by pain medications, and low-salt meals to avoid fluid retention and blood pressure spikes. So choose home-cooked foods like vegetables, fruits, dal, whole grains, nuts, seeds, lean proteins like fish or egg whites, and avoid fried foods, packaged snacks, and excess salt which silently strain the heart. Hydration is equally important, because adequate water keeps blood flowing smoothly and prevents dizziness or kidney stress. And then comes medication adherence, which many patients underestimate but which can decide whether recovery goes smoothly or lands them back in hospital, because skipping blood thinners, blood pressure tablets, or heart medications even for a few days can increase risks of clots, arrhythmias, or heart strain. So always take medicines exactly on time every day, and use a pill organizer if needed. And as days pass, you must gradually rebuild stamina by adding light household tasks, slow stair climbing with railing support, and structured cardiac rehab exercises recommended by your doctor, avoiding heavy lifting or pushing for at least 8 to 12 weeks to protect the sternum. And remember that posture matters too, because sitting straight improves breathing and circulation, while slouching compresses the lungs and causes fatigue. And speaking of fatigue, short daytime naps of 20 to 30 minutes are helpful, but excessive daytime sleeping can disturb nighttime rest. So maintain a healthy sleep cycle, because deep sleep is when most healing hormones are released. And just as important is managing emotions, because anxiety, fear, and stress increase heart rate and blood pressure, slowing recovery. So practice relaxation techniques, talk to family, stay positive, and celebrate small milestones like walking longer or needing fewer pain medicines, because each of these signs shows your heart getting stronger. And gradually over weeks you will notice breathing becoming easier, strength returning, appetite improving, and confidence building, which means you can safely expand activity under medical supervision. But always remember to listen to your body, because symptoms like severe chest pressure, sudden breathlessness, dizziness, or palpitations should never be ignored and must be checked immediately. And ultimately, faster recovery is not about doing more but doing the right things consistently every day. Gentle movement, correct breathing, nutritious food, proper sleep, medication discipline, and emotional balance. And if you follow these simple principles with patience and trust, your heart will heal stronger than you expect, allowing you not just to survive surgery but to return to a healthier, more active, and more confident life, because recovery is not the end of your journey but the beginning of a second chance for your heart and your health.